My name is John Lavery, and this is my electronic poster on psychological disorders. So I chose schizophrenia. So I said my title is Schizophrenia Real? So the reason that I chose that as my title is because, as I'm about to explain to you, schizophrenia, multiple symptoms of schizophrenia have to do with kind of an altered reality. So schizophrenia, actually, if you break up the word, it basically, schizo means split, and phrenia is in this case like the mind. So it's like a split of the mind. So that's how they came up with the word. So to really understand schizophrenia, it's best to know that there are two basic kinds of symptoms. So there are positive symptoms and then there are negative symptoms. So the positive symptoms are basically things that occur due to schizophrenia, whereas the negative symptoms are things that are taken away from the individual because of the schizophrenia. So a couple examples of positive symptoms are, they experience a change in behavior. They have kind of exaggerated ideas and perceptions or actions. So basically, they won't know what's real. Like I mentioned in the very beginning of the video, they might often think that the FBI is listening to their phone conversations, or that the newscaster is trying to deliver a message to them through the TV. Often, they don't quite understand, basic things that people without schizophrenia would understand, that the newscaster is not talking to them. They can also suffer from hallucinations, see things, hear things, feel things, like bugs crawling under their skin, or, voices talking to them, telling them. They could be positive voices, they could be negative voices. It's just the fact that they hear voices that aren't actually there. So the negative symptoms of schizophrenia, like I said, they are examples of things that get taken away from the individual because of the disorder. So that it's almost similar to like depression, because they will often have, the depression and mood. The negative symptoms are often what lead up to the diagnosis of schizophrenia, because the individual will have a lack of, concentration. Kind of funny, right? A loss of interest, social phobias. They won't be able to be in social settings or interact with people on a social level, whereas most people would have no problem with. So it can often be misdiagnosed because of that. Schizophrenia is a very commonly misdiagnosed disorder because there's a lot of symptoms that are shared between disorders. So the negative symptoms often are what, like I said, appear early on in the beginning stages of schizophrenia. And now the DSM, which is what psychologists use to kind of track and diagnose people with disorders. That's actually what it's called, is the Diagnostic and Statistics Manual for Mental Health. That there's actually will be a list of symptoms in there, like the delusions, the hallucinations, disorganized speech, chaotic behavior, any form of the negative symptom. And they have to have an active, example of that symptom for 1 month. And it has to go on for a period of at least 6 months with no other, mental disorder attributing to it, like substance abuse or anything like that. It has to be strictly because of the schizophrenia. So that's kind of how it gets diagnosed. So those are the signs and the types of symptoms. So the possible treatment for schizophrenia, the main thing is antipsychotics are used a lot. Medication, the medicine approach to therapy, while also having clinical therapy. So the clinical psychologists, also like family therapy, group therapy, those are all things that need to work in relationship with medication in order to bring a positive outcome for a schizophrenia patient. So it's more often occurs in men than women. So often the onset is in the mid-20s for men and late 20s for women, but it does seem to be more, happens more often with men. So that's my poster on schizophrenia. And as you can see, there's actually a picture of a person, their gray matter, and their a brain image, how their brain looks completely different than a quote-unquote healthy person without schizophrenia. So there is actually a neurological difference. So thanks.